Hi, and welcome back to 10 Kids, 2 Docs, Parenting Insights from Pediatrician Moms. I'm Dr. Sylvia Bank.
And I'm Dr. Vivian Carlin. Welcome back.
Welcome back. Today's topic is going to be a question that I get in the office all the time. And that question is, why is my child getting strep throat so much?
Yeah, I obviously would get this question a lot in the pediatric emergency room. I'm really excited to hear your primary care perspective on this and how you advise families.
Great, let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
Okay, so I think the first thing we should do is set the stage as to what strep is, streptococcal infection. So before we talk about why kids keep getting strep or strep over and over again, let's just talk about what strep is.
Okay, yeah, I think that's important so that we're all on the same page. When we say strep throat, we are referring to a very specific bacterial infection. That is Streptococcus pyogenes, also referred to as group A strep. So when you go into your doctor and they do that rapid strep swab, that is checking for this very specific bacteria that causes strep throat. The other interesting thing about that very specific bacteria is that it is very susceptible to penicillin.
Right.
So I've had this come up where I diagnosed a child with strep throat and I prescribe them penicillin or amoxicillin if they are still taking liquid. And I might get back the question of, oh, amoxicillin never works for my child for their ear infections. Well, that is an entire different category of bacteria, which is confusing. Whereas it's really nice that strep throat is always caused by this bacteria that does not have resistance to amoxicillin and penicillin. I think it's also important to say about strep throat that there's a peak in strep throat that is really school-age children. So right around ages 5 up to adolescence, that's when we see a peak in diagnoses of strep throat. But it's super important to note that when your child has a sore throat, it is not always strep throat. In fact,
Right.
only 25-30% of throat infections come from strep throat. So, for example, in my large family of 6 children, we would go through seasons where everybody would be sick and they would be complaining of sore throat. And they might have some other mild symptoms, but sore throat was the primary symptom. And I would pick the one guinea pig child that I was going to take in to get strep tested because I
Mhm.
knew that most likely this was viral, but I
Mhm.
needed to confirm that we didn't actually have strep going through the house. So I would pick that one and they would get swabbed. And if their strep test came back negative, then I would feel very confident, assuming it wasn't strep because again, it's only 25 or 30% of the time. Like there's
Right.
so many viruses out there that cause sore throat.
Yeah.
Sylvia, before we move on, I think it would be really important. Let's just highlight the basics of how we treat strep throat.
Sure. So the recommendations that we give, like you said earlier, we treat with a penicillin-like antibiotic, either penicillin if they swallow pills, amoxicillin if they are liquid, and then we treat that twice a day for 10 days. And it's important for patients to take the full 10-day course, even if they're feeling better,
Mhm.
finish the full 10 days. The other recommendations we give is that the child with strep is contagious until they're on antibiotics for 24 hours. So, parents often want to know when they can go back to school. Antibiotics for 24 hours, then they may return to school. The last tidbit and recommendation I give is that parents should look to change the child's toothbrush about 36 hours after they start the antibiotic so the child doesn't reinfect themselves after the treatment is over.
Yeah, I think that's all really helpful, useful information to review.
Have any of your kids had strep throat?
Yeah, so I do remember one time that I had a child test positive for strep throat. So, like I described, my philosophy in a big family is if we have something going through and it's predominantly sore throat and I'm concerned about strep, I pick one and have them tested. I've never had that come up positive, and that's probably because as I have multiple children that are sick, it's more likely to be viral. As
Right,
contagious as strep throat is, viruses are even more contagious. But I
right.
do remember one of my children who had a really sore throat and nobody else was sick. And I did take them in to get tested and he did have strep strep throat. That's the only time one of them has been positive. I've had strep throat twice, but interestingly, they were both since I've become a pediatrician. And
Mm.
I remember vividly the first time I got strep throat. I had a child in the office. I swabbed them, and that child coughed right into my face. And 2 days later, I had sore throat. And sure enough, I tested positive, as well as the patient did, for
Right.
strep throat. How about you?
I think one of my children had tested positive once and then just treated with like a penicillin related antibiotic and that was it. And I think I've had strep throat once. So
Yeah.
not very much in my family either.
Yes, I think what you and I are describing is that for most families, for most parents, you will encounter strep in your child maybe once or so over
Mhm.
the course of their childhood, or maybe once as an adult you'll encounter it. I think
Right.
that's what most people's experience is. It's very treatable, it goes away. In the second half, I want to set the stage for that child that continues to get episodes of strep time after time after time.
I'm going to describe something to the listeners and it's a thought process. So I want people to kind of stay with me as I describe this. So when there is a family or a child that gets strep throat like 3 times in 2 months, they've gotten it and they come back and they have it again and they have it again. There's this question of why is my child getting strep throat so much? And usually in this type of child, I start asking more questions than just the symptoms of the child. The question in my mind comes up as the provider whether or not there is a strep carrier. And
Mm,
a streptococcus carrier is someone who lives with the streptococcal bacteria in their posterior oropharynx that isn't sick. So
mhm.
it's not causing disease.
Let's make sure we're all very clear on what a strep carrier is.
Sure.
So, group A strep, the Streptococcus pyogenes, the only bacteria that causes strep throat, it's possible to have that bacteria sitting in the back of your throat in that tonsillar area and not causing infection. It's just living there. It's not causing any problems. It's not causing infection. It's not going to cause any of those like big scary things that people think of related to strep, like rheumatic fever. It's just sitting there happily coexisting and not causing your body any trouble, and you have no idea. And
Right.
sometimes the only way that you know that you're a carrier is because somebody else in your house is a victim of your continual exposure
Right.
and they're getting sick with strep throat and you're not. So this is the scenario that we're describing is a strep carrier, a true strep carrier is that person who has it living in their throat, coexisting with them and not causing infection. The only quote unquote symptom that you have of that is that somebody close to you is continually getting strep throat.
Like another way that I think people think about it is a colonization. Like people
Mhm.
understand that bacteria live with us in a lot of places in our body. Like the GI tract, we have bacteria that live in our GI tract that aid in our digestion, living in harmony with us. There's bacteria that normally live on our skin,
Sure.
not causing disease. It's just part of this colonization. And having Streptococcus pyogenes colonized in the back of your throat, not causing disease, is another way of thinking about a strep carrier. But that person that carries the strep can get other people sick. So, my first question usually is are there other children in the household? And oftentimes the answer is yes, they have a sister, but she's never sick, right? She's not
Mhm.
getting strep throat all the time. And that is usually a red flag to me to say, hey, is this a chance that the sister who isn't sick with strep throat is a carrier of the streptococcal bacteria and then repetitively exposing their sibling and getting them sick all the time?
Yes,
So,
yes.
right, this is kind of what I start to investigate because sometimes the parents are like, let's just have the tonsils taken out. We've had strep so much. And I take the effort to go through this strep carrier consideration in order to save a child from a potential surgery to remove their tonsils, right?
Right, and we know, the tide on that has turned a little bit. We know that the recommendation now is to really delay taking the tonsils out because it's been shown that that's not necessarily effective.
Right,
Children can still get strep after the tonsils come out. We do want to save them the surgery if they don't need it. And sometimes also growth helps as they get older and are growing through adolescence. That can help this too. So
right.
I think ENTs and the AAP literature in general are supportive of waiting to take the tonsils out.
Right. So, what I usually do is bring in the sibling.
Okay.
Go ahead and get the sibling tested, even if they're not sick. And if they test positive for strep, either from the rapid test, which is the one that comes back right away, or from the throat culture that they send off to the lab and then grow, and it's usually 2 to 3 days, those results come back. If the sibling tests positive for strep, even if they're not sick, then we go ahead and treat them for the carrier state, which is a slightly different treatment than treating them for regular strep. And then afterwards, we bring both children in, test them one more time with a follow up culture. And if they're both testing negative, then we know that no one has active disease and no one is a carrier.
Right. Do you only test the children? Do you ever consider the parents? Are
Sure.
parents ever strep
I
carriers?
think parents can be strep carriers. Sometimes it can be the nanny or the babysitter. Sometimes it
Mm,
can also be the kid that sits next to you in class, right? That
interesting.
gets a little bit harder because you can't just
Yeah.
ask your neighbors to go get tested. So I guess it can be a parent, and in the literature, sometimes it is a parent, but I always start with siblings, right?
Yeah.
That's
Yeah.
where I begin.
When we think about how strep is contagious, and I think about my own children, I mean, they are often sharing drinks as much
Yes,
as I tell them not to, especially in the young school age. They're like eating from each other's plates. They're maybe sharing a room, a bedroom,
right,
sharing the sink where they're brushing their teeth. Their exposure to each other is so much higher than anybody
right.
else.
So there is a second level to this strep carrier and diagnosing the strep carrier, because sometimes the child that keeps coming in for strep throat, that child is actually a carrier. I'm going to describe how that's possible. So, like you mentioned in the first half, most sore throats are viral in nature. So if you're a strep carrier and every time you get sick, your parents bring you in because you have a sore throat, if you are a carrier, you are going to test positive every time you come in.
Mm,
So it
yeah.
looks like you're getting strep all the time, but in fact, you're just getting viral illnesses with some sort of pharyngitis, and every time it's coming up positive for strep. This is where it gets more difficult to diagnose you as a carrier because you're actually sick when you're coming in. So, the way that I determine whether or not this child that is tested positive back to back is a carrier or actually getting sick every time is I try to look back in the chart to see if they've ever tested negative for strep. Let's say
Okay.
they had strep 3 times in the last 8 weeks, but last month they tested negative with a negative culture. Then I pretty much at that point feel reassured that you're not a carrier. And so you're getting sick from someone else. Or sometimes the story is, oh, they have a headache, and then I know it's strep. They don't even have a sore throat or a fever.
Sure.
Every time they have a headache, we bring them in and he has strep throat. That's sometimes a red flag for me to say, hey, maybe you're a carrier. I sometimes wind up treating that person for the carrier state. And after the treatment, then we bring them back when they're well, test them, make sure that they test negative both on the rapid and the culture, and then we know that they're not the carrier and they're not sick. So this is kind of like the mystery. And when you have homes like you and me, where we have
Hmm.
more than 2 kids, we have 4 or 6. I have a family with like 8 kids that we did this strep mystery. Sometimes it involves bringing all the siblings in at once,
Right.
testing
Right.
everyone, and then figuring out who the carrier is. Sometimes I describe this carrier state to kids by making an analogy to a video game that they play called Among Us. Have you
Oh,
heard about
that's
this game?
funny. Yeah.
Where,
Yeah.
they're
Totally.
kind of like all these like different colored guys in these like space suits, and one of them is the imposter, right? And the
Mm.
goal is to like figure out who the imposter is. So it's kind of like we're all the same here, and the carrier is like the imposter, and we're trying to figure out who that person is. It's something that I talk through with parents quite regularly when we are seeing recurrent positivity with strep testing and how
Yeah.
we
Yeah.
go about investigating that.
While we don't want to make specific recommendations on how that's treated or prescriptions that are written for that, we do want to inform our listeners so that they can have an educated discussion with their own pediatrician about this as a possibility if they're being plagued with that recurrent strep infection in their child.
I hope this is useful. I want this episode to be something to let parents start to think about when they start questioning why my kid keeps getting strep throat, and to maybe be able to guide you on how you may be able to talk with your pediatrician and discuss the investigation of a possible strep carrier in your family. I just also want to give a shout out to primary care here, because a lot of times when you are going to different urgent cares or different providers just for the quick test and the treatment, there can be another layer of thought beyond just let me get my antibiotics so I can get to school in 24 hours. It's more like, why is this happening? And the primary care provider can really serve this role in taking that step back, thinking about the family, thinking about preventative in a way that, the modern busy family may be just going in and out of urgent care that isn't really happening. So I think it's important for patients to be informed that this is a possibility so they can bring this to the attention of potentially the urgent care provider or your primary care provider, right?
Yeah. So now that we've talked about this strep carrier state, I think that a logical question that I would have as a parent that I see a lot of parents have is, now, I'm worried if my child has strep, I want to make sure we catch it and treat it. What if I don't realize? And what if I don't catch it in time? And when should I come into the pediatrician to be checked for strep?
Sure. I feel like when your child is sick,
yes,
they have fever, high fever sometimes, they feel terrible and awful. And as a parent, you're like, what can we do to make this child better? Of course, if you come in and they have strep, then we treat. So
right.
If they're sick, by all means, come in, test for strep, and we can treat them and make them better.
When we think of all of the things that can cause sore throat, we've mentioned viruses being very high on the list, which can be difficult to distinguish from strep. Also allergies, right? Mm-hmm. That's very high on the list too. So, for that parent who has that child who has a couple days in a row of complaining of sore throat, but they're eating, they're not having fever, they otherwise don't seem sick, I would not be worried at all.
If it's just a tickle or it's a scratch in the throat and you're not sure yet, as a parent, I feel comfortable as a pediatrician mom, and I'm sure you do too.
Yes.
Like, we can wait, 24 hours, see if it gets worse, see if they get sicker, see if they develop fever.
Sure.
And then that might tip my scales to say, okay, now we're going to go, to the pediatrician and get tested and treated if you have strep.
Sure. 2 to 3 days, even if they're doing well, if they're doing okay at home, you can wait.
One of the other recommendations I have, and I tell people this too, because sometimes parents, they feel like they come too early and they're not testing positive, and a day later they come and they test positive. Yes. I usually tell parents, if you're worried and you want the most accurate strep test you can come first thing in the morning, gross and dirty. Like, usually you're like, okay, we're going to the doctor's, go up and brush your teeth. If you want a very sensitive strep test, no toothbrushing, no eating or drinking, as gross as you can be first morning, that will usually, in my anecdotal experience, get a positive earlier.
Right.
If you wash everything away.
I don't think we have a randomized control study on that for the incidence of positive strep in that scenario, but it certainly makes sense and it certainly can't do any harm. Right.
To come gross. Come gross.
No, I love that. I love that. High concentration of bacteria in there, and then we're more likely to get it. Okay, I see that. I think it's also to point out that, like any illness, we talked about prescribing antibiotics. That's not a quick magic fix. It does take time, and it's supportive care, just like any viral illness that would cause sore throat. Right. So Motrin, Tylenol if needed, and lots of fluids and lots of cold fluids or soft things like yogurt, applesauce, that kind of stuff, just to get through that phase of them feeling sick. It's important to also note that if you happen to be that unbeknownst to you strep carrier out there, you don't know that you have it. So you are actually not having any type of reaction to the bacteria sitting there. So that puts you in a different category. You're not in the category where we're concerned about the complications of a strep infection. Right. The bacteria is just happily sitting there and you're not getting that reaction of being sick.
Yeah. And like we said in the episode, the reason why you treat a strep carrier is because they have the potential of getting other people sick.
Yeah.
Right?
Yeah. Yeah. This is a tricky one because we generally on this podcast, we want to stay in that realm of parenting advice. So take this as that advice of how do we think about strep? When do we take our kids in to get checked for strep? And then how do we even have enough information so that you can have a discussion with your doctor about strep carrier status, right?
Right.
This isn't meant to be medical advice on how to treat it or when to treat it or anything like that, but to just give you a little bit of a mindset so that you're informed enough to even be able to start the discussion with your doctor.
And it's definitely a parents under pressure topic because families that have one kid that gets strep over and over and over again, that is very stressful for a family. There's missed work, there's missed school.
Mm-hmm.
They want a reason, why is my kid getting sick all the time? Right?
Yeah. Yeah. Well, hopefully this podcast helped families think that through.
Yeah.
And feel empowered to have that discussion.
Yeah, I hope so.
Okay. Well, this is 10 Kids, 2 Docs. I'm Dr. Vivian Carlin.
And I'm Dr. Sylvia Bank.
We'll see you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.